For more on the state of telehealth and its future, including a look at how Medicare plays into that future, we welcome Will Humble, Executive Director of the Arizona Public Health Association. Will, good to see you again. Thanks for joining us.
Good. Thanks, Ted.
What are your general thoughts on telehealth?
Oh, I'm so glad that not just Medicare and Medicaid, but other payers are really embracing it. Before the pandemic, really most payers, insurance companies, were really reluctant to reimburse for any kind of telehealth. But when it became a necessity during the COVID pandemic, I think they all saw this really has a high return on investment in terms of patient satisfaction and also being able to manage patients more easily and removing some of those barriers like transportation, providing better access in rural parts of the state, et cetera.
I was going to say, especially in rural areas, this is, I mean, holy smokes, this is a big deal.
Yeah. Imagine you're somebody in Sierra Vista and your doctor's in Tucson. I mean, a doctor visit becomes an all-day ordeal, basically. This way, for certain visits, and Dr. Marvasti did a nice job describing that it's not appropriate for everything. Sometimes you need to come in, but it really helps make it easier for that patient to maybe not take a day off of work, avoid all the extra transportation. Sometimes elderly patients shouldn't really be on the interstate anyway. So yeah, it's been super helpful.
And almost every circumstance and situation, it's always better than no visit at all.
Correct. And he described it.
Yes.
You know, part of it is doing triage, so you can figure out, okay, this is something that we can manage this way. Well, let's change your medication. Let's ask you to go in for a blood test, send those results in, and then you don't have to do that physical driving. So it really, as you said a second ago, it really helps, especially in rural areas where, you know, drive, and not just the driving, but there's a lack of psychiatrists and other practitioners in the rural parts of the state that make it so that it's nearly impossible in some places to get an appointment that you need.
And that physician shortage, that shortage of physicians is
Correct.
real. All right, Medicare, telehealth, where do we stand? Where is that headed?
So before the pandemic, there was hardly any telehealth at all. There was a little bit for some behavioral health visits, but they made the patient go to like a telehealth studio. So they still had to, instead of driving to the doctor, they were driving somewhere like this where they were, you know, but during the pandemic, they're like, okay, that's not going to work anymore. So we're going to allow patients, just like you saw in that clip, doing the visit on like Zoom or something in their house. And so that became the norm during the pandemic, and Medicare then saw the real value of that. So where we are right now is at the end of the public health emergency, telehealth was going to end. It was going to go back to the old way. Congress reauthorized it for 2 years, but that deadline is now December 31st of this year. So if Congress doesn't do anything before the end of the year, we're going to go back to pre-pandemic, and there's going to be some really upset people because people have gotten used, patients and physicians have gotten used to this new way of managing patient care.
Is there anything pre-pandemic that would still be covered by Medicare? Are there certain aspects?
Yeah, behavioral health. Certain kinds of behavioral health visits would still be covered, but it wouldn't include the entire scope, which has been so valuable, not just behavioral health, but also we talked about chronic medical conditions in that clip, and other just primary care visits too.
Some of the concerns I've seen regarding, you know, Medicare getting involved here on a permanent basis would be that it could drive up spending and that it could in some way, shape or form impact quality. What do you make of that?
Well, yes. So the study during the pandemic, it was about a 0.8%, less than 1% increase in Medicare costs because of telehealth, but that doesn't include the things that you prevented, like emergency department visits and inpatient hospitalizations, which is the offset. So if you're going to be able to, if you have more primary care visits, all the studies show you're going to reduce expensive hospitalizations and emergency department visits. So it's probably something like a wash, but that study hasn't been completed yet. There are concerns and legitimate concerns about some doctors, not people like Dr. Marvasti, but some who decide, you know what, it's cheaper to do, I could see more patients on telehealth, so I'm going to do that all day, and I could get the revenue in and make more money, but it comes at a cost to some of those patients. So you need to have So my advocacy is to really do something. It's called the Connect Act, which is in front of Congress, and that doesn't just extend the current pandemic type of telehealth, but it includes more provisions to ferret out and identify fraud, and to make sure that the telehealth visits are really focused on the appropriate kinds of visits, not just any old thing.
What about like some sort of standard telehealth licensing system? Would that make sense?
Well, yes, and that's part of the Connect Act as well.
Okay.
So that you provide more tools to identify fraud, but also provide the licensing provisions that you're discussing, and make sure that the telehealth visits are really focused on those type of visits that are appropriate for telehealth.
Is the situation right now, as Congress sits right now, amenable to this kind of extension?
The Connect Act is bipartisan, and so there's a lot of bipartisan support for the more comprehensive package.
Right.
But in an election year like this, is it going to get over the line? My fear is, I don't think there's a danger of telehealth going away, but I'd hate to see this just kick the can down the road 2 more years, because what we need is a comprehensive package to make this more sustainable and focused, because we learned a lot during the pandemic, and the Connect Act takes into consideration. It says, look, now we've learned a lot about this. This is the way we want to do it, and it's a more complete package. I hope they pass that instead of just do another extension.
But kicking the can is better than adios.
Oh, of course. Yeah.
Yeah. Before you go, and you got like 30 seconds to a minute here, where does Medicaid fit in all this?
So Access, which is our Medicaid program, they began really to embrace telehealth during the pandemic. It's still going under the Hobbs administration, and so they've got good controls. It's a different program than Medicare, but yeah, Access has been embracing it, and they've got a good program going. And there's a lot of, patient satisfaction surveys show people really like this, and not just Medicaid, but Medicare.
Yeah, all right. Well, very interesting. Will Humble, Arizona Public Health Association, all things telehealth. Good to see you.
All right, thanks.